Good afternoon. Today we're going to be talking about the Marburg virus disease. The Marburg virus is the cause of Marburg virus disease, and it has a scientific name of Marburg virus, which makes it very simple to say and keep track of. It comes from the family Filoviridae, which it shares that family with Ebola. That's the only other virus in the family. So that gives us an idea of what kind of disease this is and how nasty it can be. It used to be called Marburg hemorrhagic fever, but they've dropped that for just Marburg virus disease. And there's a couple variants, which is important to recognize because it shows what the differences between some of the occurrences of this disease are. Transmission of the Marburg virus occurs through the swapping of bodily fluids, uh, blood, tears, saliva, urine, diarrhea, all can contain the virus, and you can contract it from contacting any of those. The natural reservoirs are the Rhotetus fruit bat, typically found in northern Africa, as well as some primates can have it and not show disease. Other primates can contract it and show disease. So they can be a reservoir or not, depending on what type of primate it is. As well as swine can contract the disease and become symptomatic. And if you contact them or eat their meat because it has their bodily fluids, you can become sick from Marburg virus disease through those. And so the disease that the virus causes, called Marburg virus disease, is a severe hemorrhagic fever disease. From your infection time to presentation of the disease and symptoms can range anywhere from 22 to 21 days, which is a long time from exposure to symptoms. And typically, once you do show symptoms and have disease, it lasts 8 to 15 days. Though, if you're going to die and it is a deadly case, it will typically occur on the 8th or 9th day that you are showing disease. And even if you stop having symptoms, the infection persists and you can still transmit the disease. Um, Pregnant women can pass it on in their placenta to anyone that touches it when they give birth or their children. And men can pass it through their urine for a long time after they have stopped being symptomatic but are still infected with the virus. And so what happens when you start to show symptoms, it starts off fever, headache, malaise, muscle aches, very basic disease signs and symptoms. You get your headache with a flu, with Ebola, with all sorts of diseases. Um, and so it's a little bit difficult to tell if you don't know you've come in contact with the disease the first couple days. It starts to get nasty days 3 to 5, though. You get explosive watery diarrhea, lots of abdominal cramping, vomiting, nausea. Your face will start to get gaunt and ghost like, and that causes a lot of. You start to see how severe the disease is by then. And once you make it past day 6, that's when it's at its worst, that you'll start bleeding from all of your orifices, your eyes, your nose, your anus, your genitals. Um, your mouth will bleed. And if it's not taken care of, your insides will almost start to liquefy in a way that they're not supposed to be liquid. Um, and because these are the symptoms that we see with Marburg virus disease, you have to treat those symptoms because of their severity. the fever can become extremely high, so you've got to keep your temperature down. Your blood loss and fluid loss with the diarrhea and bleeding, your blood has to be replaced. Those fluids have to be replaced, or your body will shut down. And because there is no cure for Marburg virus disease, um, anything specific they can give you to get rid of it, that's all they can do is make sure you have fluids, keep your breathing up, keep your fever down, and hope that you stick around long enough for your immune system to kick in. Because that's the only way you can get through this is through your immune system. Um, though we are starting to think and try possibly that because it's related to Ebola and presents similarly, that maybe some experimental treatments from Ebola would work. So that would be great. Well, there's been more occurrences than what you can see here. These are the significant occurrences. Most others have been two, three, four uh, cases, but these are the significant ones. Um, in Germany, one of the first known cases of Marburg virus disease had 29 cases, 7 deaths, mortality of 24%. But then when we get in Africa, Democratic Republic of Congo and Angola, there's a lot more cases and a lot more deaths, having the mortality of 83 and 88%, showing the difference in medical care. But that gives us an overall mortality of 50%. Um, let's see if we can back that up one.